In this video, we'll show you how the digital doctor team helped a doctor go from trading his time for money at his practice, missing plenty of family time, to starting his very first passive income machine with just 1 hour of his time each week. Watch until the end of the video and you'll know exactly how you can do the same.
Hi there, how you doing?
I'm doing well, thank you. Thanks so much for taking the time to connect with me this evening, Dr. Omar. I know
All of that.
Yeah, I know it's late in the day for you, so I really won't take up too much time. Of course, we have an awesome opportunity. Really happy to sit down today. Thank you so much for taking the time to, share your experience in the done for you service up to date, just any, thoughts, feedback, the process. Really hoping, of course, your story so far will just be able to provide some value insight for those who are potentially considering even joining the program, what your experiences has been like up to date, any impact, any wins that the service has made up to date. I know you've been working with us for quite some time now. So,
Yeah.
first time you and I are connecting, face to face. We've had so much email correspondence, but could you take a moment and, even enlighten me on your, professional career and really what got you to where you are today?
So, speaking about me, as you know, I'm consultant venous surgeon and phlebotomist, been working varicose veins for the last 17 years of my life. Experience of at least 10,000 patients. I stopped counting after 10,000 patients. Yeah, the idea is that in my specialty, the phlebologists that you can count in one country, usually you can count us on the fingers of one hand.
Wow.
The remaining, those who treat varicose veins usually are vascular surgeons, mostly arterial surgeons, and they do veins from time to time. But those who do only and solo veins, nothing except veins, you can count us really on the fingers of one hand. And you cannot really be good in what you do if you don't do it each day, every day. You give your whole time just for that one thing, to improve yourself in that one thing. And that's what happens now with the veins. Technically, I simply dream veins. What can I say? Yeah, but I really mean it. So the idea, all my career, all my advancement is just based on veins, to get the very best in the treatment, to get the insight of understanding everything about veins. And it was really an idea to spread that knowledge a little bit more, because it's the cases that we see and the suffer that we see among a lot of people just comes mainly from the lack of understanding of that illness, the lack of understanding of what that illness is. How can we treat it? If we really can treat it, you'll see a lot of doctors saying that varicose veins, for example, they keep saying that it's an untreatable condition. Once you have it treated, once you have it, you'll have it all your life, which is absolutely nonsense. It's absolutely nonsense. So they keep saying things about the science that was about 150 years ago, that once you treat your veins, you'll have your varicose veins come back again and again and again. But the modern science is that if you treat varicose veins properly, the risk of recurrence, risk of having varicose veins again, is no more than 3%. So it's absolutely nonsense when you keep telling people, no, you'll have it all your life. The idea is that that misunderstanding led to real bad advices given to patients. I had one of my youngest patients and one of the most advanced patients that I've seen, and believe me, I've seen a lot of my life. That was one of the most advanced. He was only 21 years old boy, and he had one of the most advanced varicose veins cases on both legs, open ulcers on both legs. I remember his father brought him to me, brought him to see me, because he was suicidal. That kid was almost suicidal. Yeah, he was not able to walk because the ulcer was just on the ankle, on the joint. Not able to walk, not able to work, not able to have a social life, not able to do anything, in pain, just crying, sitting, not able to do anything. And his GP, unfortunately, was telling him that, well, wait till you're 60 or 70, and after that, we'll do your surgery, and we hope that we can do something. He's only 21 years old. He had no life. He really attempted to kill himself. And his father brought him to us. Just please, if you can do something. Yeah, we scanned him. We've seen him. It's varicose veins. It's an advanced, yeah, fine, but it's still varicose veins. Did his surgery. Uh, I did his procedure. I remember. So I did his surgery, splitted his procedures on each leg. So I did 3 hours in the morning, 3 hours in the afternoon for each leg. So it took me 6 hours surgery per leg to do his legs. But after that, I did it and it's fine. And I remember him in 1 month. He came wearing a suit. That kid came wearing a suit. I remember when he saw me in the clinic, he started marching that, that military march, and
Mhm.
gave me that military salute and said, and exposed his legs, and ulcers healed. And he was, thank you, for first time in my life, I have a job. After the job, I can go and get my girlfriend, go for a walk. We're getting engaged next year. And he has a whole life
Wow.
from a suicidal. And that comes from just a misunderstanding of a simple condition. I don't want to say about patients who I've received who were on the amputation list for simple varicose veins. That was, I always say it, that's on the principle, I have headache, okay, take off his head, something like that. If you have varicose veins, you treat the legs, you don't take off the leg, for God's sake. And you see these indications given by vascular surgeons, by GPs, by different specialties that have no clue about veins and how to treat them. When you ask them about veins, the last paper that they've read about veins was 20 years ago. Till
Wow.
now, they use the names that have been changed 20 years ago. And it's not one report or two reports that we see with the old names still used. These are things that happen almost every day, and it's quite worrying. So that where came the idea of that course, building a course, try to, okay, I'm only one in my place, but if I can have a way to reach to more people, to get that knowledge, spread that knowledge, at least, I cannot treat you, but at least I know how to, what advice to give you. I tell you, okay, go search, there's a hope. Or those patients who had treatment, but they had failure of treatments. I've operated yesterday on a patient who had 5 surgeries per leg, all
Wow.
failed. Yeah, it was a nightmare. But yeah, you can do it after all. You can fix it after all. Takes a lot of time, but yeah, you can do it. Okay. But the idea, misconcepts, misunderstandings, and that gives the idea of building that course, reach to people, spread the word, make things more known. That's the idea. That make it absolutely make awareness, raise awareness about it. Hey, yeah.
Yeah, I hear you, Dr. Omar. And I mean, I feel like I have a good understanding in terms of why you decided to start working with us and, create an online course. But just so I can hear it in your words, like what was your primary motivator then to want to create an online course about varicose veins?
So the idea, as I said, raise awareness. That's on the professional thing. Teach as much doctors as much patients as well. Teach them about varicose veins. I have discussions, and yeah, it's mainly to raise the awareness. And if we want to discuss the personal side of it, it's just what can I say? I'm not getting younger. I think I'm getting older, and at some stage you don't have the same power like I had in the past to operate till 12 o'clock in the evening or 2 o'clock in the morning, continuous fires, continue. I'm getting older, so I think it's the time to start to spread the word and maybe focus more on teaching.
Of course, yeah, and share some of create a legacy as well for all of the hard work that you've done up to this point. And also, what were some of your, financial goals before joining
So
the
the
done for you
financial goals,
service?
as I said, I want to, so personally speaking, to have that freedom, that
Mhm.
um, financial freedom. I'm not sure if I word it in the correct words.
Yep,
So the idea, I have 5 kids, and for me, it's, yeah. Well, a man has to do what a man has to do. What
you're a
can I
busy
say?
man.
Exactly.
Yeah.
So I really want to spend more time with them.
Mhm.
And as a surgeon and as a doctor, time is not the best thing that you can say that you have.
Mhm.
And I really feel bad about each moment that I lose with them. I want to be more around. That's the idea.
Mhm.
On the other hand, in the last 2 years when COVID hit, I had a weird way of COVID, a weird case of COVID. So I knew about my COVID infection. The symptoms started like symptoms of a heart attack. So I thought I'm having a heart attack because all the symptoms were towards a heart attack. And heart attack in smaller ages is a life-killing thing. So I went to hospital and it was COVID. So that were the first symptoms of COVID, symptoms of heart attack.
Wow.
The idea is that I was thinking, okay, if I cannot work, if something happens to me, what will happen to that big family? I have quite a big family, and I'm responding as responsible of them. My wife is a pharmacist, yeah, but she sits with them, she teaches them. It's not all about money in a family. You need to raise humans, you need to raise kids, be around, teach them, be with them. So we decided I do the work, she's with the kids, all that. So the question was, what will happen if something happens to me or I cannot work? We're living in a life. So I want that freedom, that financial freedom, and to be able to be around with them, to be able to, yeah, just that freedom, that financial freedom. That makes a lot.
Hmm. I
Means a
hear
lot. From scientific point of view, you can focus on research, you can focus on reading, you can focus on other things. From personal point of view, you can do a lot of things. It's just, yeah, that I'm buying time, I would say. I'm buying time to be with my family more.
I hear you. And we hear that quite frequently. So yeah, I completely understand that. So I mean, Dr. Omar, where did you first hear about Digital Doctor?
Funny enough, I'm a consultant. Beside being a consultant, I'm senior lecturer at the College of Lebology in UK.
Mhm.
And we had a gentleman who came from Australia, a doctor who came from Australia, and I was teaching him. And between the discussions, he told me, "Why don't you build a course?" And I was like, "Course? What course to build? I'm a surgeon. How can I build a course? A course about what? I'm not teaching cooking or something. I'm teaching surgery. How can I build a course?" And he said, "Well, I heard about a company called Chester Zoda. And, you know, I'm a businessman. You don't need to say something more than once in front of me, and I just catch it. I just wrote it on a paper and was searching on that after that. So on Chester Zoda, what's Chester Zoda? He was saying, yeah, they build courses for doctors and they help and da da da. But you have to be careful because a lot of companies do that. So I just heard about them and I was looking and da da da, but still thinking. So okay, cool. So they teach you how to do courses. Yeah, they do courses. And that night I went online and opened on and started searching on it.
Mhm.
And it didn't take more than 2 days to actually communicate and yeah, get into the thing.
Oh, wow. And you mentioned your colleague from Australia when you guys were at a conference. That's how you heard about us. Wow.
Yeah, it
Goodness. That is
was
yeah.
in a talk, in a 10 minutes talk. He mentioned you guys and I said, okay, cool. So I wrote it on a paper and that was how you get in it. So it's mouth word.
Yeah, word
That
of
makes
mouth.
wonders.
Yeah, that's amazing to hear. That's a super cool story to hear. So, I mean, you've been working with us then in the Done For You service in particular for about, 6, 7 months now, I believe. How has the past 6 months been so far working with the team as well as your coach, Jesse?
So Jessie is a wonderful girl. What can I say? She's a wonderful lady. She's really wonderful. She's really professional, and all the team have been like that. All the team, I don't have except good words about you guys. So really good words, and I really have big hopes with the course. I'm not saying that about just to be polite. I really have extremely big hopes about that course and about the outcome. The Yeah, the 6 months, they were wonderful. Honestly, to do the course alone. The courses are good. The courses are really made for layman who has no knowledge in technical things, in these high tech things. But for a doctor who's really busy, even if the courses are made, step by step, do that, get that, it's really difficult to find time to do that, to listen to the course, to actually apply it, to actually solve the problems that come in. And I have a principle: do it with a professional. I'm good in my job, you're good in yours. Okay, so it's like that. I cannot be everything. So I have a belief: do it with the best. They will know you're the best in your job. You do it the best. You'll get way better outcome than I'll get if I do it. And that was my principle of doing, asking for the done for you route. uh, I know it might be a little bit costly, but you know what? Um, Quality costs. So that's principle, quality costs, and it's worth it. That's the only thing that I can say. It does worth it. You want a Mercedes, you pay for a Mercedes. You want a Russian Lada, you get a Russian Lada, but with low money. But you want high quality, you get high quality. You need to pay for high quality, and absolutely okay. I'm absolutely okay with that principle. It's in commerce and any business.
Yeah, I hear you. And I mean, thank you for that. I'm really happy to hear that your experience thus far has been great with the team. Only a couple of more things that I have for you, Dr. Omar. I mean, who would you really
You
recommend
can
the
call me Omar. Call me
oh,
Omar. Only Omar.
only Omar,
Omar.
okay. Like who would you recommend the fast track to, Omar, for, anybody considering joining, any future students? Who do you think this is specifically for?
Well, I think at some stage, any doctor with experience should do that. Any doctor with experience should do that. Um, I think it's more suitable, obviously, for maybe people with a higher income might be more able to do it. But those, the only thing is that those who you have a lot of doctors with a lot of experience, but might be not that with high income because they work only in state hospitals. And I'm afraid those will not be able to afford doing
Mhm,
the course. That might be a thing. You might want to make many packages,
mhm.
so lower packages, something like that. Again, don't misunderstand me, just a friendly, really friendly speaking,
Well,
friendly
of course,
advice.
of course, of course. Yeah,
But
okay. Yeah.
on personal scale, I think I'm meeting with my own brothers, and I think they will be following to be your students as well.
Oh my
I
goodness.
have
Your brothers are, of course, in the medical field
older
then as
brother is a
well.
plastic surgeon, and younger brother's ophthalmologist. He's an eye surgeon, and I think they will at some stage they will follow that track.
Wow. Well, keep me posted. Keep myself or Jesse because we do have an affiliate program as well. I'm not sure if she's mentioned. So, I mean, if you refer them and they enroll, you could actually earn some money from that referral. So when the time comes, just shoot me an email and I'll set you up with that.
No
Um,
worries, it's absolutely fine.
that's awesome, Doctor. That's awesome, Omar. My only last question for you is, what advice would you give to people or anybody watching or who have thought about joining a fast track and are skeptical or just on the fence about it?
Just go ahead. Don't think twice.
Okay.
Just go ahead. Don't think twice. It's a good scientific opportunity, good business opportunity, good personal opportunity. You're earning. It's win-win-win. Scientifically, you're spreading your word, you're spreading your knowledge. And that's what all medicine is about. Spread the word. You make the life of a lot of people way better. We always want more experienced people to speak, so we learn from each other. That's one. Uh, Business point of view, as a doctor, not sure if you have any other opportunity. You need to go to teaching at some stage, and the sooner you do it is the better for you from business point of view. You have another income beside, and that really impacts everything in your life, psychologically, physically, mentally, socially, from all points of view. And from family point of view, what can I say? Time is the point. If you earn more time, then you're the happiest on the earth. You got your family,
Mm-hmm.
and that's what all life about.
Mm-hmm. I hear
So
you.
don't think twice. For me, that was the biggest opportunity. And again, although we didn't start doing the marketing, and we will start hopefully next week doing the marketing, I can't tell you how much big hopes I have. Really, extremely big hopes I have about that program.
Yeah. Okay. That's amazing. That's all on my end, Dr. Omar, my apologies. Is there any other, questions, feedback, concerns, anything else that you wanted to connect about today?
No, I'm just really happy with everything. What can I say? Again, I have only good words about you all guys, and I would recommend you with no hesitation for anyone. I would recommend you 100% with no hesitation for anyone. If you need any time, any help for anything in your marketing to, as a recommendation, always happy to help with that. It's well done, you guys. What can I say? Well done, you guys.
Want to turn your knowledge into a passive income machine? My company can help. We've helped 2,000 health professionals generate passive income using the knowledge that they already have. Now, we don't work with everyone. We only work with qualified experts in their field with at least 3 years of experience. So if that's you, and you want to earn an extra $10,000, $20,000, even $30,000 per month in passive income, book a call down below. You'll be speaking with a member on our team, and we're going to show you the exact 4 steps that we're going to take you through to build your very first passive income machine. This is a system that you only need to build once, and it can pay you for the rest of your life. Click the link down below to learn more.